Bonjour.
Recording in progress.
Je peux commencer maintenant. Merci beaucoup tout le monde. C'est un grand plaisir d'être ici pour une annonce vraiment historique pour le pays, d'augmenter notre système de santé ici au Alberta, à l'Alberta, et d'être ici aussi avec le ministre LaGrange et c'est un grand plaisir, absolument. Et I want to start by acknowledging that the land on which we gather is the traditional territories of the people of the Treaty 7 region in southern Alberta. The city of Calgary is also home to the Métis Nation of Alberta, both districts 5 and 6. And it is an incredible pleasure to be here today. I want to start by saying thank you to Minister LaGrange. We've had the opportunity now to talk on many occasions, and one of the first meetings that I had was with Minister LaGrange in her office, talking about our shared priorities and talking about our aspiration to be here today for this announcement. We know the challenges that face our healthcare system are profound, that across the country, folks are having difficulty accessing a family a health team, getting access to having a relationship with a doctor, to make sure that they get the healthcare they need. They have backlogs. And we know that on the part of those that are in healthcare, that the experience of the pandemic was deeply traumatic. I think it was a trauma for everybody. We're all coming to terms with it, but specifically for those that were working on the front lines of healthcare, it was profoundly different. And there was a hope, I think, for all of us when we came out of the pandemic, that things would be easy. But challenges persisted. The impact of the pandemic has left us with cancer suffering in terms of their mental health. And I mentioned those backlogs and challenges to access to healthcare that we need to address, and which today is part of. But there was a moment, I think, in the pandemic when all of us were pulling in the same direction, where jurisdiction, ego, partisanship was all set aside, and we had one simple question: how do we help Canadians? How do we make sure that people are safe? How do we take care of them in terms of their health? And I know for Adriana and I, when we talk, it's very much about that spirit of cooperation, about how do we, there's lots of things to disagree with. That's easy in this world. How do we find common ground? How do we find solutions? How do we work together to get things done? And I think today is an important example of what is possible when we focus on what we can do together. And I look as well, the opportunities that exist in our health system. I was extremely excited just last week to announce the Canadian Dental Care Plan, which is going to mean for hundreds of thousands of Albertans and certainly 9 million Canadians in its final iteration, that every Canadian will have access to dental care they need, which isn't just an issue of a good smile or social justice. It's fundamentally an issue of prevention. We know that cardiovascular disease or diabetes are heavily impacted by oral health. And we know that somebody's ability to go in and get that job, or to have the courage to go and take a chance in their life on a new business or a new relationship, is very much dependent upon the confidence they have in their smile. So that's going to be fundamentally transformative. So focusing on prevention, focusing on access to family health, to make sure that people have a relationship with a doctor, making sure that also we work together on data. Minister LaGrange and I in PEI had an extremely constructive meeting with our counterparts across the country, talking about how we can work together to share data. We know that data saves lives. So bringing down those barriers and focusing on cooperation is absolutely essential.
Ça, c'est les raisons pour lesquelles aujourd'hui est tellement important. Le gouvernement du Canada investe près de 200 milliards de dollars sur 10 ans pour le plan Travailleurs ensemble pour améliorer le soin de santé pour les Canadiens. Et c'est clair que les attentes avec des provinces et territoires vont améliorer notre système de santé dans une façon tellement importante.
It will expand access to family health services, including rural and remote areas. It will support healthcare workers and reduce backlogs. It'll increase mental health and substance use support. It will modernize healthcare systems with health data and digital tools. Today, Minister LaGrange and I will be signing a bilateral agreement under this plan, a plan that sees $25 billion to province and territories for tailored bilateral agreements in addressing the unique needs of people in each province and territory. It's part of that $200 billion I was speaking of. This agreement will see more than $1 billion flow from the federal government to Alberta over the next 3 years. It's a critical investment and part of a 10-year plan for collaboration. As part of this agreement, Alberta's action plan to deliver measurable improvements to the healthcare system by 2026 is outlined. With this plan, more appointments will be available to Albertans throughout the province. It will increase diagnostic imaging capacity in the provinces. It will reduce wait times for CT scans and MRIs. It will improve Albertans' ability to access digital healthcare services and their own health information. Under this plan, First Nation and Métis in the province will have access to high-quality, culturally appropriate care through dedicated funding for supports and initiatives. Finally, this agreement will enhance support for individuals with mental health challenges and people who use substances. It will also reduce median wait times for community mental health and substance use services. This includes nearly 100 new mental health programs for youth in schools across the province, offering more supports for youth with complex needs as they transition to adult services, reducing the median wait time for community mental health and substance use services by establishing new treatment and optimizing existing ones, prioritizing culturally appropriate Indigenous community supports. This is certainly proof that our governments are working together for the better healthcare Canadians and specifically Albertans need when they need it. It's evidence that working together creates results. Today, by signing this agreement, we're making a concrete difference in the health and well-being of Albertans all across the province. And with that, it's my great pleasure to turn it over to Adriana LaGrange, le ministre de la Santé pour la province de l'Alberta.
Thank you, Minister Holland. And you're absolutely right. Access to healthcare is top of mind for all Albertans. And Alberta's government is taking a serious look at the way healthcare is delivered in our province. This is why our government is refocusing our healthcare system to ensure Albertans have access to timely care when and where they need it. This agreement and initial funding will provide incremental funding, approximately $1.1 billion in additional healthcare funding to support health and mental health priorities over the next 3 years. It will be used to support actions and initiatives outlined in Alberta's action plan under the agreement. These actions fall under the 4 shared health priorities, which are expanding access to family health services, including in rural and remote areas, supporting our health workers and reducing backlogs, improving access to quality mental health and substance use and addiction services, and also modernizing health systems with health data and digital tools. I sincerely want to thank Minister Holland and the federal government for working with us to reach this agreement. You've been great to work with, Mark, and your team. As is the case in every other province, we know the healthcare system in Alberta is under strain and change is needed. Our goal is to improve the delivery of healthcare for all Albertans and for our frontline workers who work so hard each and every day to serve their patients. Albertans want and deserve easier access to a primary care provider, such as a doctor or a nurse practitioner. They also want urgent care without long wait lines, access to the best continuing care options and supports, and improved access to mental health and addiction treatment services. Built on the exceptional skills and work of healthcare providers, Alberta is reforming its healthcare system by strengthening governance, building capacity, and enhancing the delivery coordination for the 4 pillars of our health system, which are primary care, acute care, continuing care, and mental health and addictions. We are making significant and targeted investments to improve capacity and the delivery of healthcare in our province, and addressing the challenges we know are putting strain on our valued healthcare workers. With the largest budget for health spending in our province's history, It's 26.4 billion right now. We are investing an additional 262 million of the new funding to strengthen our primary care system. An additional 104 million is committed to Alberta's health workforce strategy that sets out a framework for supporting the province's current health workers and building up this workforce so that it can support Albertans and ensure they get the health care they need when and where they need it. A healthy, sustainable, engaged, and efficient healthcare workforce is essential to ensuring timely access to healthcare now and into the future. Alberta is also Alberta is also looking at funding models that will better support family doctors so that they can spend more time with their patients rather than spending their time on administrative tasks. In addition to continuing to support our family physicians, Alberta will also be one of the first provinces to allow nurse practitioners to operate their own clinics based on their scope of practice, thus expanding our workforce even farther. Another key area the new federal government funding will support is improving access to quality mental health and addiction treatment services for Albertans. Minister Williams could not be here today, but I do want to take this opportunity to share a bit about how this agreement will help and support the work his ministry is doing around mental health and addiction. Alberta is committed to supporting the mental health and well-being of all Albertans and has made significant investments as we build out the Alberta recovery model. Specifically, the new model and the new funding will be used to maintain the enhancements previously supported in the bilateral agreement of 2017. So this includes enhanced mental health and addiction, community-based services, crisis support, outreach services, and adding intensive care options. There will be a continued focus on enhancing mental health and addiction services for children and youth by implementing more school-based supports in high-priority communities, as well as providing more access to clinical mental health and addiction services through community day programs and residential treatment options. Increasing access to mental health and addiction supports for adults to reduce wait times will also be a priority for the new funding. Some of this new funding from the federal government will also contribute to ongoing improvements to data infrastructure and sharing, so healthcare teams can securely work together to optimize patient care. Integrating primary healthcare services through data is particularly important for those living in rural and remote parts of the province. The funding announced today will help us address some of the challenges we are experiencing around healthcare in our province. However, we remain hopeful that a meaningful and permanent increase to the Canada Health Transfer will happen. There are significant issues facing the delivery of healthcare, not just in Alberta, but right across the country. With more sustainable, predictable funding, we can optimize the opportunities for healthcare improvement unique to our residents and make progress on longer-term public health goals. And I'm confident working with Minister Holland that we can achieve that end. So again, thank you so much. And off we go.
Thank you, ministers. We will now proceed with media Q&A, starting with questions in the room. If you wish to pose a question, please do so from the floor mic that you can see on the side of the podium over here. And I'm sorry, and one more thing, just one question, one follow-up, please, after you state your name and outlet. Thank you.
Calgary. Question for the federal minister. the breakdown of the $1 billion per year to Alberta, what does that look like per year to Alberta?
Yeah, it's 1 billion. So it's 1 billion, it's close to 1.1 billion over three years. So it's a little more than $300 million every year. And I think we outlined exactly which different areas that it's going to.
Okay, thank you. Question for Adriana. Minister, there's been some controversy about the nurse practitioner program online over the several days here. A number of nurse practitioners have been introducing alternative therapies, such as homeopathy, Reiki. Even one had a mediumship for the dead. This was brought up by the breakdown. I'm just wondering if any of the money that's going towards from the province to nurse practitioners will be used to cover any kind of alternative therapies.
Well, nurse practitioners are going to be held to the same standard we hold all our healthcare professionals, and nurse practitioners, we're still in finalization of their agreement in terms of a funding model. That will be coming in January, but all practitioners will be held to the standards that we hold, the high standards we hold. So we will dig into what you were talking about, but all nurse practitioners, they do provide a valuable service. They're highly skilled, highly trained, and many individuals are looking for an increase in a healthcare practitioner access, and they do provide that valuable service. But we will look into what you're talking about.
Tyson for CTV. Question for a colleague of mine, Minister LaGrange. This one's for you off the top. I know a couple months ago you were asked about vaccination around COVID and influenza, saying that you had a pretty strong immune system. And at this point, just with the low vaccination rate in the province at the moment, are you willing to tell Albertans why it's important to get vaccinated at this point, and whether or not at this point you are vaccinating COVID and flu?
Well, I have received 3 of my COVID shots. But that being said, I think vaccination is a personal choice and something that needs to be discussed with their healthcare professional. When I look at vaccinations, they provide a valuable tool to reduce illness. And we have seen that with children across the decades. When we look back at polio and some of the other diseases that have affected children, illnesses that affected children very adversely, and the fact that we've been able to diminish them, in some cases eliminate them, eradicate them, vaccines play an integral part in that. That being said, vaccines are a personal choice. I do recognize that there's vaccine fatigue out there. And so we have to meet people where they're at and provide them the information they need to make good choices for themselves and their families.
Follow-up for Mr. Holland on this regards to this. Can you maybe talk us through the slow vaccine process for Canadians at this point? Is it important for public officials to announce if they've been vaccinated or not? Does that actually change the messaging? Does that actually help get people out vaccinated?
I think that, let's step back and recognize that vaccines have been a miracle of science, that we have nearly wiped out measles, mumps, rubella, whooping cough. That during the darkest days of the pandemic, when we were wondering whether or not a vaccine would be possible, people said it'd be 10 years, that in this country it saved hundreds of thousands of lives. And we know how important the flu vaccine is. And so I would say that, we listen to the best data and science. That's what we do to try to protect our health, have a conversation with our doctor about what's in the best interest of our health. I don't think that getting into, pushing one another individually about what somebody has done or not done is particularly helpful. I think that really what we should be doing is talking about what medical experts, are advising us to keep ourselves safe. We're in a respiratory illness season right now. We're seeing a spike in respiratory illnesses. We want to make sure that our hospitals are kept as free to deal with other emergencies as possible. We know that getting your vaccine regimen of both the flu vaccine and the COVID-19 vaccine for the newest variants means that particularly for vulnerable people, for elderly people, are going to keep folks out of hospitals, are going to reduce pressure on our hospital system. So I would really encourage people to do that. And that's the conversation I think we should be having in health, just about what the science and data is saying, and encouraging people to have conversations with medical professionals.
Hi there, Sarah Offen, Global News. This message is for Minister LaGrange. I'm wondering if you can comment on Globe and Mail's article outlining that the Alberta government directed AHS to remove the words influenza and COVID from the fall immunization campaign, as well as to limit information on vaccine benefits and efficacy. You spoke about the importance of providing that information. Can you talk about what the strategy is here?
The importance also is to recognize that we're in an endemic stage. We were in a pandemic, we've gone to an endemic stage. And so now really to look at including COVID as part of the RSV, influenza, all of the respiratory illness. Obviously, it has still a significant portion and is playing a role in that, the increases that we're seeing within our hospitals and within the general public. But it really is to place it where it needs to be moving forward, which is part of that respiratory illness group of illnesses that we're seeing affecting Albertans.
For Minister LaGrange as well, 25 emergency department closures in Southern Alberta in 2023 occurred. There's a lack of permanent physicians, lab techs, x-ray techs, and because of that, people are utilizing emergency centers in larger cities. Can you talk about how the province is going to be prioritizing that rural healthcare to take the pressure off of major cities?
Absolutely. And it is really something that we're focusing on, particularly through our bigger endeavor to refocus the health system in Alberta. We really want to make sure that the rural hospitals, the rural health centers that we have, whether they're urgent care centers or ambulatory care centers, that they're actually properly resourced, properly staffed, and that they can stay open the hours that they need to be open to provide the services to Albertans. That has not happened in the past, and so that's a huge priority of ours, and it is a major focus of what we're doing in that refocusing of the greater system. And this is something that is very near and dear to my heart, so we're working really hard on making that happen. So thank you.
Any other questions in the room? D'autres questions? Okay, with that, I will turn it over to my colleague Tammy, who's going to moderate the online media Q&A. Tammy, can you hear us?
Yes, I can. Thank you very much, Barry. We will now proceed to questions from journalists on Zoom. If you are a reporter and wish to ask a question, please use the raise your hand function. Unless I have stated it, please indicate your name and media outlet before asking your question. Nous allons maintenant prendre des questions des journalistes sur le Zoom. Sauf je l'ai dit, veuillez identifier votre nom et votre média avant de poser votre question. And it looks like we're going to start with Tessie Sanchi. Tessie, go ahead. Your line is open.
Good morning. Thank you. Yeah, it's Tessie Sanchi with Hill Times Research. My first question will be for Minister Holland. Minister, I just want to ask about the timing of these agreements. The BC agreement was announced in October, and now within the last 2 days, you've had 2 agreements. Just curious, has there been a last-minute push from your office to kind of try to check more of these off of your to-do list? And what can you tell us about what's coming up in 2024?
Well, thank you so much for the question. Yes, we just had PEI a couple of days ago. In BC was a couple of months ago. I think what it's fair to say is that this is a real process. There's a lot of work on talking about shared priorities and getting to a point of having an agreement. And then there are logistical challenges of scheduling the opportunity to come and be in different parts of the country to launch this. Adriana and I have been working through the details of the plan for a long time to get to a place where we're both on the same page and where we think that we've got the plan that works. And so that takes time. And then there's the other matter of the house sitting. We just finished sitting last week with rather long nights and sometimes no nights at all. And so that meant that we had a little bit of time this week to be able to launch and show some of that work that's been happening behind the scenes. And I just want to again acknowledge that Adriana has been an excellent partner, that I've really enjoyed getting to know you, Adriana, over this last while. And I think that we have the opportunity through focusing on what we can do together to do a lot of great things for Albertans and for Canadians. In terms of the upcoming agreements, there are going to be a lot. There are 26 in total, because it's not just the working together agreements, it's also the aging with dignity agreements. So we have announced 3 of 26, and by that math, That's 23 more to go. And it's my intention to be there in person in every part of the country. So that's going to take some heavy lifting. I can tell you that it's going to be a pretty busy calendar in the first quarter. And obviously, I'm also going to be going around and talking about what's forthcoming in terms of the Canadian Dental Care Plan, talking with provinces and territories about how we work together on that.
Thank you, Minister.
I
Tessie,
just-
sorry. Go
Yeah,
ahead.
that's okay. I'll target my next question to Minister LaGrange. Minister, you both have spoken about the level of cooperation, but you are also from a province that is very vocal about jurisdiction.
Sorry, I think we lost the.
Okay, that's okay. I keep getting muted, but that's okay. We'll try to get through this one. Minister LaGrange, both you and Minister Holland have spoken about collaboration and ongoing cooperation, but you're also from a province that is very vocal about protecting provincial jurisdiction. I'm just wondering, were there any sticking points within this agreement that you can point to, maybe over the issues of jurisdiction, and how did you work through those?
Well, it's as in any negotiation, there's always ups and downs and points that you want to haggle over. That being said, I would say that there's opportunities here to celebrate the fact that we have gotten to a signed agreement. But as Minister Holland has indicated, it has been a journey to get here. And part of the journey for us is really reinforcing the fact that that Alberta has jurisdiction over health. The provinces have jurisdiction over their health portfolios, their health ministries, and what they provide to their citizens. And we're really in the best position to acknowledge and know what needs to be done. So flexibility within a contract, flexibility within an agreement is essential. And I would say it was really making sure that we had the flexibility we needed. I understand that the federal government, they want to see outcomes, and we do as well. We want to see those outcomes as well. It's very important that the money goes to what it's designated for, and that we see tangible outcomes. But we also need to have that flexibility within our province to provide the services that we need to our citizens. And so it has been a journey to get here. I'm pleased that we've been able to get here on this bilateral agreement. We have others that we're working on, and I'm sure we're going to have our ups and downs on those as well. But at the end of the day, we can celebrate the good news of today.
Thank you.
Any more questions online, Tammy?
Yes, we have a question from Logan Steen.
Hello, Logan Stein, City News
Sorry.
6 here. I have a question for Health Minister LaGrange. With the province's vaccine intake the lowest it's been in over a decade, is it fair to say that there needs to be a new and improved approach overall to inspiring Albertans to get vaccinated? I understand you touched on vaccine fatigue, but if so, what can truly be done differently when we're seeing spikes of all kinds of illnesses that we haven't really seen spikes of in a long time, such as whooping cough, which is seeing a huge increase right now around the province?
Well, and again, I would say that the vaccine hesitancy is playing into some of what we're seeing. We are trying to get the message out to Albertans that vaccines do play an important part in protecting themselves and their children, and utilizing all the methods that we have available to us. But ultimately, it is a choice, a personal choice of parents and their families to make with their healthcare providers. And we will continue to make sure that we're giving out good information so that individuals, so Albertans and their families can make those good choices for themselves.
But is there a feeling of overall being concerned about such a rise in some of these illnesses when we haven't seen that rise in so long? I understand that it is about, Albertans speaking with their family doctor, but when we're seeing such a huge increase in some of these illnesses, does that not kind of raise some alarm bells there?
We're seeing that right across Canada. Alberta's not unique. We're seeing it right across Canada, right across the globe, actually. And so I think there has to be a broader conversation, but also recognizing where people are at. This is not something that we can force people to do. And so we need to make sure that we provide them, as Minister Holland said, with all the data, the science, and the knowledge and ability to make good decisions and to be able to speak with their healthcare practitioners. And going back to the announcement today, in Alberta, currently, we have approximately 700,000 people who do not have a primary care provider. This is something that we're looking to tackle with these dollars that we have now provided to us to actually expand access. And so that is also an issue when people do not have a primary care provider that they can have these meaningful discussions with. That factors into what's happening across the province as well.
Thank you very much.
Thank you very much. Are there any additional questions on Zoom? Dernier appel pour des questions sur le Zoom. I don't see any additional questions, so thank you very much. Et bonne journée tout le monde.
Thank you. Thank you. Thank you.
Recording stopped.